Hello, everyone. Welcome to One Mind Brainwaves. I'm Brandon Staglin.
I'm living my best life. I wake up with the sunrise. It does not look a thing like I thought that it would, but I've been.
Today's topic is obsessive-compulsive disorder and thriving with it. OCD, or obsessive-compulsive disorder, is a sometimes debilitating brain health condition that is characterized by symptoms such as ongoing intrusive anxious thoughts that can lead to recurring unwanted behaviors. Now, these symptoms can wax and wane across the lifespan, but they're often worst in times of extreme stress. They can actually begin as early as childhood. Fortunately, brain scientists are investigating the circuits and the genetics in the brain behind how all this works and developing, as we speak, better treatments and diagnostics. One of the leaders in this science will be joining us later in the program. Her name is Dr. Susanne Ahmari, and she's a one-mind Janssen Rising Star Awardee. But first up, we'll be joined by a young individual who has lived experience with OCD himself, and this has led him to become a mental health innovator at age 18, no less. Mikey Taylor, thanks for joining us today in Brainwaves, and welcome.
Hi, Brandon. Thank you so much for having me.
You bet. It's great to see you today. So, Mikey, thanks for joining us. And viewers, you're welcome to post comments or questions in the chat at any time. And if you have anyone who you think can benefit from the information and insights we're sharing today, please share this webcast with them. Thanks. So, Mikey, let's get to you. When did you, I want to hear your story. When did you first start experiencing the symptoms of OCD, and how did you first experience the signs and come to understand what they meant?
Yeah, so I would say I've experienced the symptoms of OCD kind of for like as long as I can remember. I mean, the very first time where I experienced symptoms of OCD, I was probably like 4 or 5 years old, and this was in like kindergarten, first grade age, where I wouldn't be able to sort of have as much fun doing, like coloring, drawing, schoolwork, stuff like that, that other kids were able to have a lot of fun with. And at the time, obviously, I didn't know it was OCD. I just, had it in my mind that I had to, like color this picture just right. Everything I did had to be perfect and live up to these like very high expectations that I had. And so when I wasn't able to, do things just the way I wanted to do, I get very anxious, and I would kind of, redo those tasks of like coloring or whatever the assignment was over and over again, to the point where, it would take me like a very long amount of time to do something that was like very simple. Right. And I just wasn't able to, have fun with it. And then as I got older, in elementary age, middle school age, was when I really started to experience the kind of like disturbing intrusive thoughts, right? So it was around that time where my anxiety had gotten very bad, and I was very down on myself too, kind of like judging myself for these intrusive thoughts. And it was just very hard for me to do things in an amount of time that like other kids and other like students in school could do, just because in my head, it was almost like everything had to be just right. So like my homework would take me like a much longer amount of time than it did for the other kids, right? And it was very hard for me, because of these disturbing intrusive thoughts, to like do things by myself, because kind of like my way of coping with these intrusive thoughts was having to, like have like my parents by my side. That was kind of my way of like getting rid of my obsessions, kind of like my compulsion. So, I mean, it wasn't until I was like 13, 14 years old that I was like actually able to sleep in a room by myself because of these intrusive thoughts. It was hard for me to, like be in a room by myself, things like that, like other teenagers wouldn't have a problem with. Right. Um, and I mean, I was lucky in that I was able to get access to the resources that I needed. But I'd say that's the pretty general recap on like my OCD for the past like 18 years.
Yeah, thanks for explaining that, for explaining some of the symptoms that you experienced. And some of this actually is a bit resonant for me as well. People often have the expression like, I'm so OCD today. And some people may think of that as like an overstatement, and maybe even, I don't know, offensive if you actually have the condition. Others I've heard think that it's great to kind of normalize terms like that describe different mental health conditions, so people are more comfortable talking about them. How do you feel about that that idea?
Right. I mean, I certainly get both sides. I understand why people think that, like using those terms in everyday language, may be a positive thing because you're kind of like putting that topic into mainstream. But at the same time, it sometimes feels a bit diminishing just because
Mhm.
it's like of the seriousness of OCD. The
Mhm.
way the media often portrays OCD is just like being very over organized and like being
Mhm.
afraid of contamination, washing your hands all the time.
Mhm.
And I feel like when people say, oh, I'm so OCD about this, I'm so OCD about that, they're usually reinforcing those harmful stereotypes,
Mhm.
which can kind of make me and my like OCD feel invalidated.
Okay.
Uh, but I do understand both sides. So.
Thanks for sharing your perspective on that. It's really helpful to hear that, and I'll use care in the future in describing my own experiences, and hope others will too. Thanks for sharing that. Because OCD it really is a brain health condition, and it can really get in the way of life. Um, there are no actual, diagnostics for OCD that are biologically based, and maybe this has something to do with people's not really understanding what it is. But because of this challenge in diagnosing OCD in general, how did you come to actually get that diagnosis? And how did you have challenges in actually getting help managing your symptoms because of that?
Yeah, so I would say it was pretty difficult to actually like get that diagnosis and figure out that like that's what all of this is. It's OCD, considering that like I'd probably been experiencing symptoms for like 10 years of time before I actually received a diagnosis. And I mean, part of the reason was too, I mean, I was very young like during that period. Um, but it did take a long time. So I mean, eventually I had seen like therapists before and gone to therapy and it was helpful, but again, because I didn't really have the diagnosis, I don't think it was like addressing the root of my problems. But then it was when I was actually able to see a psychiatrist when I was like 13, 14 years old that they were able to explain to me that, like this is can all be explained by OCD. And then that was kind of it was very I would describe it as receiving the diagnosis as a positive thing because a lot of times I'd labeled myself with like harmful rhetoric, words like crazy or like insane, just because of like the disturbing, intrusive thoughts that I was having. But getting that diagnosis kind of made me feel like not so alone. Like, oh, so many people are dealing with the same thing that I'm dealing with, right? Um, but it did help me get the right treatment for me, the right therapy, the right medication. But even that too took quite a bit to kind of find out what worked for me, right? Because I mean, there's a shortage of mental health professionals as there is. And I guess people have this idea sometimes that, like once you're in therapy, like that's awesome. Like you're in therapy, right? And of course it's a good thing, but like it doesn't necessarily mean that you're actually benefiting from the therapy. Like I certainly had therapists that I just like I didn't connect with, right? And I didn't necessarily vibe with them. But then it was once I, found that right therapist that I really vibed with, and once I found the right medication for me that worked for me, um, my symptoms had improved greatly. But it was like a lot of trial and error, right? But I guess that's part of the reason too why I'm so excited by like precision psychiatry. So like trying to get genetic data and neurological data to predict responses to different treatments to kind of like reduce the amount of time that we need to actually treat disorders like OCD. But yeah.
Yeah, that's fantastic. And I think that resonates with a lot of young individuals and families and individuals in general who experience mental health challenges, that it's hard to find the right treatments from the get-go, because there's the diagnoses are so kind of fuzzy, and it's not really known what works best for each individual person. But like you say, persistent psychiatry could be a key helping a lot of people. And it's cool that all the work that you're doing as well. Yeah, and let's get into that. As I mentioned, at the tender young age of 18, you've already embarked on an amazing career of research in neurotechnology and mental health solutions. How did your lived experience inspire you to want to pursue this? Can you expand on that a little, please?
Yeah. So around the time that like I had formally received that OCD diagnosis, I became very curious as to like, like why do I have OCD? Like I remember literally I probably like Googled that when I was like 14, like why? And I mean now that question's so naive because I mean we don't exactly know, right? But I went down this rabbit hole through that of just like the neurological, genetic, environmental factors that contribute to OCD and all of these other different mental health disorders and well-being in general, right? And I just thought the research was so fascinating. And I mean, considering that it affected me personally, it was something I was like really motivated to kind of contribute to. And being in, like seeing the problems and opportunities within the mental health system myself made me kind of like more motivated to want to make an impact in this space. So around like I want to say when I was like 14 15 years old, I taught myself neuroscience, I taught myself how to code, I taught myself machine learning, I did all of this research by myself, and then basically just like reached out to researchers that I was really interested in and cool companies that I thought were doing cool stuff, and just set up calls with them and like talk potential collaborations. And then that was how I was able to get involved in a lot of the research in the space.
That is really cool. It's so easy with a mental health condition to simply say, "I've got this. I'm gonna just live with it, make the best of it in the life that I can eke out for myself." But you've gone a step much farther than that, and you're working on ways to make your own life better and other people's lives better too, which is pretty darn amazing. And extraordinary. So we often talk about neurodiversity on this show and the fact there can be benefits and advantages for some people who experience certain mental health challenges, in fact, due to the brain differences that are associated with that brain health condition. Do you find that your OCD benefits you in the work that you do at all?
Yeah, so that's a very interesting question, and I would say that there definitely are ways that OCD has like positively impacted my life in a way. I mean, I think part of the reason that I'm doing the work that I'm doing right now is because I'm very driven and I'm very ambitious, and I have these goals and I really, really want to meet them. And in a way, I would say that OCD is kind of helping me do that a little bit, and do things like meet deadlines, ponder things for a really long time, try to understand complex processes. And like these are all things that are very beneficial in like neuroscience research and science in general, right? So to that end, I would say, yeah, I sometimes do feel like I'm able to sit and do work, and just read for longer periods of time because of my OCD, just because I'm so like detail oriented sometimes. Um, so I would say that I think it makes me more of a creative thinker as well.
That is really cool. That's really cool. You can focus so well, especially in this like social media saturated world where so many distractions are around. To be able to focus like that, I think it's a gift. And so I'm glad you could do that. Such benefit for so many people. What are some projects that you're most excited about that you're working on right now?
Yeah, so one field that I'm very interested in right now is the gut microbiome. So for anybody who maybe doesn't know what the gut microbiome is the gut microbiome, it's essentially a collection of all of the microorganisms, so like bacteria, fungi, viruses that live in our guts, right? And what we've actually found is that these microorganisms are essential to our health and are actually able to communicate to the brain, which is kind of crazy. So now people are saying things like, oh, maybe it's our second brain and stuff like that, um, just because of how much research we're finding between the composition of our gut microbiome in neurological and psychiatric disorders. So like the bacteria in our guts are able to produce neuroactive molecules and neuropeptides that can stimulate the nervous system and therefore impact our cognition and overall well-being. So what I'm interested in, what I'm currently working on, is trying to use different machine learning models on this gut microbiome data from individuals with different neurological and psychiatric disorders to try to almost create a type of diagnostic method for different mental health disorders just using that gut microbiota data. So in the real world, I hope that this kind of data would be able to help people, do things like change their lifestyle and diet based on what a definition of, like a healthy gut microbiome is, which we're still kind of trying to figure out what a healthy gut microbiome looks like. But I've been involved in that research, and I'm looking forward to hopefully collaborating with more researchers in that field just to try to do more research on the actual bacteria, the types of bacteria that are associated with things like depression and anxiety. And what I think is very cool about that too is what we're starting to do is actually sequence the genomes of these bacteria to see, what type of molecules are these specific types of bacteria producing that could potentially lead to, depressive or anxious symptoms, because then that's when we really start getting into the causation rather than just correlation of it. And we can develop novel therapeutics that are essentially gut microbiome interventions, but for your brain. We still have a lot of work to do, but it's so fascinating to me. So that's kind of what I've been focused on for the past few months.
Yeah, that is fascinating. I've got a million questions I'd love to ask you to expand on that. But we'll have to save that for another time. Hopefully we'll talk again in the future soon. I think you're going to be a one-mind rising star and more someday with all that you're doing. Really amazing stuff. And you're giving me a lot of hope with what you're describing today. So what words of hope do you have for other young people who may be going through OCD or similar mental health challenges?
Yeah, so I guess one piece of advice that I think of that has helped me is that you are not your thoughts, right? It's more important, the way in which you think, it's more important about how you think about what you think rather than what you actually think. And that may not make sense, but let me explain. So basically, if I have a intrusive OCD thought, maybe about harming a loved one or something like that. A lot of times what people with OCD may do is they may think that thought is morally equivalent to actually carrying out that action, right? And that was definitely true with me. And I would judge myself and, feel very down on myself for having these thoughts, right? But I think it's important not to judge yourself for having these thoughts, because at the end of the day, they are intrusive. You can't necessarily control these thoughts that you're having. So, get rid of that judgment that you may be having. And I think that goes for anybody out there. Stop judging yourself so much for the things in your head that you can't necessarily control, right? And I would also say, again, this goes for anybody, but just taking time to step away from work and the computer screen and social media and homework, and just take time to ground yourself and practice gratitude. I think that that's very important. That's something that's benefited me a lot. I think that gratitude, meaningful relationships, and finding a passion, which for me is innovating in the mental health space, I think those are three very key ingredients to happiness.
I love what you're expressing. It's profound. Are you sure you're 18? Maybe you're 81. It's all the wisdom that you have. Yeah. Okay. No, this is awesome. Yeah. Thanks for sharing all this wisdom and insight with us today, and for doing the amazing work that you're doing. And keep up the great work. I can't wait to talk to you more in the future. Thanks for being with us on Brainwaves today, Mikey.
Thank you, Brandon. I appreciate it.
You're welcome. Take care. Joining me now is Dr. Susanne Ahmari. She's an Associate Professor of Psychiatry at the University of Pittsburgh. She also is a 2018 One Mind Janssen Rising Star Translational Research Awardee for the amazing work she's doing there with her team on OCD research. Dr. Ahmari, Susanne, welcome. Thanks for joining us on Brainwaves today.
Thank you so much, Brandon. It is a real pleasure to be here. And as always, thank you to One Mind for supporting our work. It's just been a crucial source of support and allowed us to explore new directions in the lab so we can help people who have OCD hopefully find treatments that work better for them.
Yeah, the work you're doing is just so helpful, and we'll learn more about it today. I also want to thank Janssen for sponsoring your award. They've been amazing supporters of One Mind over many years, and grateful for that as well. So viewers, thank you for watching again. If you have any questions, feel free to post them in the chat at any time, questions or comments or any stories you might want to share. And if you know of anyone who might benefit from the insights we're sharing in this webcast today, please share this video with them. Thank you. So Susanne, it's great to have you with us today. You are working extremely hard on developing an understanding of conditions like OCD to improve the lives of individuals like our previous guest we just had on, Mikey Taylor, who lives with OCD. And the term OCD is so often bandied about, as I discussed with Mikey a little bit ago. What are some examples of OCD behaviors, and are there certain, is it like a spectrum, or why is it some people develop the full-blown OCD syndrome and others don't?
That's a great question, Brandon. And I think, and I'm really glad you brought up that the terminology is kind of thrown about a lot, because I can get up on a soapbox and talk about that for a while. Essentially, I think the media has often portrayed OCD or obsessive compulsive disorder as being kind of a funny personality quirk, right? It's often portrayed as being kind of interesting, funny, something to make fun of a character about on a TV show, or the alternative is that it's actually almost portrayed as something that's good to have because it means that someone is very fastidious, that they are organized, that they're very good at taking care of things. And you'll often hear people say, oh yes, she's so organized, she must have OCD. Have you seen her kitchen and the way that it's organized, et cetera? But that's actually doing a real disservice to people who have this illness, because OCD is really classically thought of as a very hidden illness. People tend to be relatively good, and this is a generality, of course, but a lot of people are very good at actually hiding their symptoms in their day-to-day lives because they've had a lot of practice doing so. And so they often, though, have to, so one classic example is someone who might have checking related OCD and fears that if they don't check things appropriately, that something bad is going to happen. So the example people might be most familiar with is something like they have to check to make sure the door is locked before they leave the house, or they have to check repeatedly to make sure that the car door is locked before they go into work. And so someone with OCD, their colleagues, their friends, even some of their family members may not know that they're suffering with this because they wake up 2 hours early every morning in order to do the appropriate amount of checks that to them feels like now they can continue on their day. And so, so people often take a really long time to come to treatment, to even realize what it is that they have, that it is something called OCD. And then once they recognize that they have it, to understand that, number one, there are treatments that can be beneficial, and number two, that they deserve to have them. And so that's and that their illness isn't just a personality quirk, that their illness isn't just something that actually helps them through their day, quite the opposite. Mm-hmm. But the other part of what you had talked about is this, this idea of, is OCD a spectrum? Is it a single thing or is it a spectrum? And that's a really interesting question. And from what we can tell, it is a spectrum. And then the question is, how do you divide it up? And what are the dividing lines in terms of how do we separate out different kinds of OCD? So classically, people have divided it up in terms of the general kinds of symptom categories that people tend to present with. And so again, most people, even if they don't know someone who has OCD, are familiar with the kind of examples of contamination and cleaning OCD, where someone might have excessive obsessions related to germs and then continuously wash their hands over and over or do other cleaning rituals. So that's classically been thought of as one type. And then checking OCD, like checking the door locks and the stove, et cetera, that's thought of as another subtype. Then you have symmetry and orderliness OCD, like needing things to be orderly, not just because it makes you feel good because it looks clean, but because you worry that if things aren't lined up in a particular way, something terrible is going to happen, like a bad outcome. And then you have kind of intrusive thoughts about taboo things that, and a classic example of this is maybe I'm going to hurt somebody else. A lot of new parents actually have this crop up when they have a kid, and they worry that they would unintentionally harm the baby. Right. And that's an OCD thought that's popping into their head, and they have no intention of doing this, but they have so much shame and guilt associated with these thoughts that they never tell anyone about it, and they suffer in silence. So those four things have been classically thought of to be subtypes. And then with a fifth one, which at some point in history was lumped in with this, but now is kind of separated because of differences in the brain that we know are there in people who have it, is hoarding. And so a lot of people who have hoarding also have OCD, but it's kind of a separate category. So that's been how the field's been thinking about it. And there have been some studies that support that model. But more recently, we're wondering if actually there are other ways to carve it up that might actually be more helpful for treating symptoms. And so that's the kind of work that we're trying to do right now to figure out, okay, both, within my One Mind project is related mostly to animal work, but in some human work that I'm doing, we're in both in collaboration with somebody else, as well as part of a consortium that I'm in, we're really trying to dive into, okay, if we actually look at the brains of people with OCD through scanning, and if we treat them in particular ways, do people who have particular scans that look one way, and so that would be kind of a subtype, are they going to respond to a different treatment than people whose brains look a different way? And so these kinds of studies require many, many participants who are willing to volunteer their time and, in order to have someone look at their brain and then look at it before and after treatment. But there's one thing that I've learned about the OCD community. It's that they are so committed to helping scientists figure out what is happening in their brains. They want to know. And the idea that maybe we could actually get to a stage where we could look at a variety of biomarkers and then figure out what treatment might actually help you is very, very appealing. So,
yeah, that is so hopeful to hear, and it's interesting to hear you say that the OCD community is so engaged with science. That's wonderful, and that fits very well with the example of Mikey, who was just with us on the show a few minutes ago, and all the work he's doing to help scientists and do work in science on his own to help understand OCD better. And you talk from a place of great kind of empathy and compassion for people who experience these conditions that can be so challenging. And you're not only a scientist, but you're also a psychiatrist, right? Do you actually treat patients who experience OCD and see these things firsthand, it sounds like?
Yes, that's absolutely right. So I worked with my first person with OCD back when I was in psychiatry residency, and it was just such a striking experience to me to be able to kind of experience from her perspective, her inner world of what was happening to her, what her experience of her own brain was like, if that makes sense. So she was just very, very good at describing on a moment-to-moment basis how she was feeling in the moments that these obsessions would pop up into her head, and how she was feeling in those moments of making the decisions about what to do in response to these obsessions. And, and of course, much of the time, especially early in treatment, she couldn't do anything in response to them other than, go into the panic that her body was driving her into, right there. I mean, she didn't have other skills to use. But through a lot of hard work on her part and through, exposure therapy with response prevention, which is a very effective treatment for OCD, if people have access to it and if people can actually do it, she made such huge progress and strides. We've actually just completed a study based on one of the ideas that she kind of helped me work through way back, when I was still a psychiatry resident, which is a while ago at this point. But and the findings are fascinating.
It's fantastic that you were able to partner so well with this patient of yours to make headway to help other people as well as that individual. How might your findings potentially lead to new treatments? And what are some of your goals in this area?
What it opens up is this idea that, okay, in someone with OCD, that you can imagine that for some people, it's that they may just generate too many obsessions and compulsions in their brain, too many random thoughts, and they might, have a sticky brain that leads them to do more rituals. Other people might have trouble like just stopping things once they get started. And so that could be a different treatment, a different way to attack in terms of treatment. But then this third category that I think we're seeing in this study is that it's just that this process of getting rid of the anxiety and the relief that people get from it is so strong that it actually generates stronger projection. It generates stronger connections in their brain so that it reinforces, it makes it keep going. So if during exposure therapy, where we're kind of presenting people with these situations, which normally would trigger their obsessions and compulsions, you could imagine if we turn down the brain activity a little bit using transcranial magnetic stimulation while they're experiencing these triggers for their symptoms, that it might not give them that same up and down of the rush, and it might not kind of get embedded in the plasticity responses in their brain. So as opposed to continuing to strengthen that connection, it's kind of like, oh, I saw that, but I don't feel like I need to do the response anymore. And that could help facilitate exposure therapy, which again is really effective if you can do it, but it's really, really hard to do. And it's hard to describe how challenging of a therapy it is unless you've seen someone go through it or you've been through it yourself. So
yeah, and I'm sure you've seen plenty of folks engage in that kind of therapy and firsthand as their treatment provider. It sounds fascinating that you could actually help kind of like liberate people from the cycle of plasticity that makes them deeper and deeper into the OCD, obsession, and help them have some freedom from that through the transcranial magnetic stimulation in conjunction with that therapy. That's amazing. So these medical treatments that are in existence and therapeutics that are in existence and more of which you're developing, are there any changes in lifestyle or practices people can do alongside those things, like meditation, for example? Like when I meditate, I find my brain isn't as sticky. I'm able to let thoughts go. I don't have OCD, so maybe I'm different, but can practices like that or other lifestyle practices help people with OCD to any degree?
Exercise, meditation, yoga, eating well, all of these things are crucial to mental health in general, anxiety and depression specifically, and will, undoubtedly also be helpful for OCD. And support, I'll just put that one out there as well. So I think we don't talk enough about social support and social structures, especially as psychiatrists. And I think it's really important that we need to do that because, I mean, if anything, if we've learned anything over the past 2 years of the pandemic, it's that our social supports and social networks are crucial to maintaining our mental health, like absolutely 100% crucial.
Absolutely. Yeah, I totally get that as somebody who struggles with schizophrenia. My sort of support network has been just a bastion of support, able to feel stronger and more resilient because I have that support. That resonates with me. But one of the things you discussed at your music festival presentation back in 2018 was the stigma associated with OCD, and particularly with mental health conditions in general, but particularly with OCD. The manifestations that people do, which you say people are fastidious to hide, they're careful to hide them in many cases, but sometimes people will see them in their social network, and perhaps families or family members or friends may be concerned and say, stop that, or that's a bad habit, and misunderstand what's going on there. How can family and friends help to better understand what's going on with somebody who has such a condition, and support them? How can they best support them in what they're experiencing?
That's a great question. And it's absolutely crucial, because again, and this is both from personal experience with, as a treatment provider, as well as from knowing literature, people with OCD take a very long time to come to treatment compared to many other neuropsychiatric disorders. And it is because of the shame, stigma, and the kind of quote unquote ability to hide it, whatever that means. It's that they again are often spending inordinate amounts of time just, hiding from everybody, and preventing themselves from doing activities that may lead people to realize that they have OCD. So many just really don't go out into the world, except for in as limited circumstances as they can, or they'll, avoid, having social relationships, having romantic relationships, because they don't want anyone to know about this. And so I think a really important part of the journey to mental health for someone with OCD is finding communities where they can share that information with other people and realize that they're not going to be judged. So resources, the International OCD Foundation, they have a website. It's I'll double check that as I'm saying this, but it should be www.iocdf.org. Again, International OCD Foundation. So if you go on there, there's a lot of resources for people who have OCD, for family members in terms of what to do if somebody has OCD. The other organization that is not specific for OCD, but is fantastic, is NAMI. So, and NAMI, for anyone out there who doesn't know it, www.nami.org. And they do a fantastic job of helping, again, both patients and family members who have experiences of mental illness to actually think about what is the best way to help people who have it.
Susanne, thank you so much for sharing all of your huge experience and expertise and wisdom with us today about OCD. It's going to help so many families and individuals who struggle with this condition to hear what you had to say today. So we'll share this webcast, and I'm glad that you will as well. Thank you so much for being with us on Brainwaves today. And viewers, thank you too. Remember, if you want to check out any past Brainwaves episodes, you can always go to onemind.org/brainwaves. where you can also sign up for our newsletter to be notified of new episodes coming out. Remember, what is a brain good for? Making waves, of course. Let's make some waves together. See you next time on Brainwaves. Bye.
Every year, 700,000 unaccompanied youth experience homelessness. On a given night in America, 41,000 youth 13 through 25 are unaccompanied on the streets.
Our young folks coming out, being real about what's going on in their lives.
Homelessness is no joke. People think, oh, you're on drugs, you're an alcoholic. But I didn't become that until I became homeless.
The problem of youth homelessness can be solved. With ongoing mental health services and housing support, formerly homeless youth can overcome the challenges of the past to build productive lives.
And no matter how many times I go back over, no matter how many problems I deal with, it's a blessing to be able to come home every night to a place I can call my home.
Support provided by Liberty Mutual Insurance, committed to better mental wellness to help all of us embrace today and pursue tomorrow.
I'm living my best